Most people in this country who have health insurance actually get their health insurance from their employer. Employer-sponsored healthcare coverage has been around forever. Most of us have it. But here's a shocking number for you. More than 24 million people in this country say that even though they have, quote, good private healthcare insurance provided by their employer, they're still unable to afford adequate medical care. 24 million people say it's still too much and I can't afford it. So we skip going to the doctor, we skip doses on our medication, we skip filling prescriptions entirely because we simply can't do it even though we have good healthcare insurance. To put that in perspective, 24 million who say they can't afford it even though they have insurance, that's actually more people than got insurance under the Affordable Care Act, under Obamacare. 66.5% of all bankruptcies here in the United States are due to medical costs and medical procedures that cause people to miss work. They end up in bankruptcy. 66.5% of all bankruptcies related to some kind of healthcare cost. Over 500,000 people per year in this country are filing for bankruptcy. I think it's 550,000 people filing for bankruptcy because of medical costs. And I want to put this in a little bit more personal perspective here. Before I sat down here, started going through looking at how much I personally pay for health insurance every single year and every single check. Out of every single paycheck I get, $199.78 is taken out. Paid bi-weekly, so every other Friday, I am paying $199.78 for my health insurance coverage that covers me, my wife, and my children. That comes to $5,194.28 per year. And that's just the part I pay. My employer, from what I'm told, actually pays 75% of my personal premium, as well as everybody else in this office here. So I'm only paying 25% of it. So by that logic, by those numbers, that means that my grand total cost for health insurance for me is a little more than $20,000 per year. And I'm having to pay $5,000 of that. On top of that, I have a $6,000 deductible. So out-of-pocket costs for me on a bad year would be $11,000. Normally, I do not hit that deductible, but this year, I'm almost halfway there. My inhaler that I have is $250 a month. My daughter's asthma inhaler is $250 per month. Other medications that my daughter has to have add up to more than $300 per month. So as it stands right now, I'm at almost $1,000 per month just on two people's prescriptions. Well, I also have a son and my daughter who have peanut allergies. So twice a year, I have to buy each of them an EpiPen. They expire every 9 months, so they make you buy them twice a year. They're $650 a piece. So $1,300 at the beginning of the year, $1,300 around August when they go back to school, so that I make sure that they do not expire before the end of the school year. So that's $2,600 a year that I personally spend just on EpiPens, almost half of my total deductible. And I have got really good health insurance. Or at least on paper, it says it's really great health insurance. It's not. We have the worst healthcare in the world. Maybe not statistically, although we are actually close to the bottom. But personally, I can tell you that because it sucks. Everything about the American healthcare system today sucks. This is why things like Medicare for All are so important. This is why policies and proposals to lower prescription drug prices, to rein in the cost of medical procedures and doctor's appointments and everything like that, that is why that is so important. I can only speak from personal experience, but I can also look at the statistics and realize that I'm not alone. I may not even be in the minority on this at this point, folks. because I know a lot of people watching this right now can relate to everything that I have said. And that is why this Democratic primary is so important. There is no way in hell I would ever throw my support behind any candidate who does not 100% support Medicare for all and price controls on pharmaceuticals and medical procedures. That's the other part of it. Because Medicare for all, yeah, that's great. But if you don't control the costs as well, and we're still having to pay out of pocket, that's not okay. I don't mind. I wouldn't even personally mind having a Medicare type plan that I had copays for. You know, yeah, I've got to pay a couple bucks to go to the doctor here, a couple bucks to go fill a prescription here. I think most people would be okay with that. But there would still be people in this country that couldn't afford it. Therefore, it's not good enough. This has to be a plan and a policy that covers every single person in this country to where none of them ever have to worry about going into bankruptcy or missing a dose because they can't afford it. Anything short of that is 100% unacceptable. Thanks for watching, everybody. And don't forget, if you like what you see here, like, comment, share, and subscribe to our channel. And now you can also become a member of Ring of Fire and get exclusive early access to certain Ring of Fire videos all throughout the week. Just click on the little join button right below the video.